Okay guys, I'm back. You can see I'm all in my PPE. I have my face shield, I have my mask, my gloves. I'm all set up with my infection control and I'm ready to do my tutorial. Again, I am going to be using the Columbia 1314. Dexter is all set up, as you can see. He's all ready. Dexter is set up. So with the 1314, first of all, I would like to just explain to you the purpose, the function, and the characteristics. It is a double-ended instrument. It has a cutting edge with two blades, which is also known as the working end. Okay, here you can see my handle. This is my handle. Okay, you can see the face of the instrument, which is this part here that's looking at you. Then you can see the round back of the instrument also. Okay, you have this lower shank, which is also called the terminal shank, which is closer to the working end. You also have the shank, which connects the working end with the handle. Now, with your two cutting edges, it is for the purpose of removing subgingival and supragingival calculus, medium size to heavy. I always like to tell people this is your first line of defense after using a Cavitron. Okay, it has this extended shank so that it is able to reach into pockets up to 5 millimeters. Okay, it has a rounded toe. It is called a Curet. It has a continuous back that allows the two blades to meet in a rounded toe. Now, when using this instrument, we're going to discuss the various purposes. Again, the purpose is to remove calculus, supra, and subgingivally. So I am going to start with the maxillary here, using it on the maxillary anterior. Okay, and I hope you guys are able to see the Dexter here. Oh, we have the light. So when using on the anterior, you want to first start with your adaptation. Now, using your adaptation, you are going to use the 1/3 side of the tip of the instrument. Okay, using the 1/3 side of the tip to adapt to the area of the tooth. I'm using it on the anterior on number 9. Now, when working on the anterior, I am sitting at a 12 o'clock position because I am working on surfaces away from me. I am going to adapt the 1/3 side of the instrument to the tooth, and I'm going to do an insertion. I'm going to go below the gingiva. Now, when going below the gingiva, doing an insertion, I am going to go in at a closed angulation, which means I'm going to go in at a 0 to 40 degree, meaning that the side of the tip is flat to the tooth so that I have an easy insertion into the to the pocket. Okay, once I have my adaptation and I have my insertion, I'm going to open my Curet with the open angulation from 60 to 80 degrees. Now, this puts me in the perspective that I am ready for activation. Activation is when I start my strokes. You have what's also known as a working stroke. You have a pull stroke, which is to pull the calculus away. Okay. You have a push stroke. You have a combined push and pull stroke. Also, you have a stroke, which is known as a walking stroke, but that is for the purpose of using a probe. Okay. I'm going to implement a little lateral pressure. Okay, I have my fulcrum here, which allows me to activate and rock my wrist motion, not using my fingers. Okay, using your fingers, put stress on the fingers. So I am going to use my fulcrum to rock back and forth. And as I am rocking, pulling, I'm going towards the midline. I'm sorry, the line angle, which is the mesial, and I start to roll into the interproximal area. Okay? Now, one of the things that's important is when you do your insertion, you want to make sure that you go all the way to the base of the pocket. Going to the base of the pocket allows you to access all of the calculus that is present on the root surface. Okay, every time you do a pull stroke, using your strokes in different directions, for the anterior, I'm going to use a vertical stroke. Okay, and every time I use my stroke or my working stroke using a vertical stroke, I want to make sure that I go all the way back down to the base of the pocket. This way I am not missing any calculus when using lateral pressure. Using my 1314 Columbia, again, which is for supra. If I just had plaque, I could stay above the gum line and activate and remove any subgingival plaque biofilm. Okay, so now if I was to come this way at an 8 o'clock position, now I'm sitting at an 8 o'clock position, if you guys can see that clearly, I am going to work with the surfaces towards me now. I'm going to flip my instrument. I'm going to adapt again here with the 1/3 side of the tip. I'm going to do my insertion at a 0 to 40 degree. Then I'm going to open it once I am into the pocket. I'm going to start my activation by rocking back and forth, doing my wrist activation, using a pull stroke, implementing a little lateral pressure. Okay, and it's back and forth. And it's not this. It's not fingers that puts stress on the fingers, in turn causing carpal tunnel, fatiguing the hand. Okay, now when you are using your working instruments or your removal instruments with cutting edges, okay, you want to make sure that you are fulcruming here on the tooth, but in turn you want to have the side of the shank up against the side of your finger, not the direct pad. This is where you get your tactile sensitivity. Okay, when using your pull stroke or working stroke, you use a firm grasp. Okay, you already then used your EXD or ODU, you know what a calculus is, you've done your calculus detection. Now you are at the point where you need to remove the calculus, okay? I just want to go back for a moment when talking about the universal, the design of the instrument, okay? The face of the instrument equals about 90 degrees to the lower shank, which is the terminal shank. I don't know, make sure you guys can see that. Okay, so you have the face of the instrument, okay, the lower shank, which is 90 degrees to the lower shank, okay. The lower shank must be tilted toward the tooth surface to establish the correct angulation. Now I'm just going to grab my mirror here, and I'm going to bring my light here. So if I am working here on the posterior, I'm just going to go here now. I'm going to see if you guys can see this, if I'm working on the posterior. Okay, if I'm working on the posterior here, I want to make sure that I have the correct working in. Okay, and if you guys can see this, all instruments come ergonomically correct straight out of the mouth. Okay, you shouldn't have your instrument tilted coming it's like almost coming to the side, almost, I say, out of the patient's cheek. Okay, this is Dexter. He has real cheeks. I'm going to have to retract. Okay, I'm going to work on this premolar. Here, the second premolar. Okay, which is number 13. I am going to place my instrument interproximally to make sure that it is parallel to the long axis of the tooth. And as you can see, that comes straight out of the mouth, and it is parallel. And I'm just going to show you the incorrect working in. When I go to place this interproximally, you can see how it is wrapped across the tooth. And if you guys can see that, let me just retract a little bit here. Okay. And can we see that? Let's move the light a little bit. And as you can see, that is wrapped across the tooth. Okay, but we want it again to be perpendicular. I'm sorry, parallel. Okay. So now I am going to start at the distal line angle, which is here. I'm going to start at the distal line angle, and then I am going to adapt. I want to make sure that the side of the pad is on the shank for my tactile sensitivity. I am going to adapt the 1/3 side of the tip. I'm going to insert at a 0 to 40 degree. Once I'm inserted, I'm going to open up to a 60 to 80, and I hope you guys can see this clearly. I'm going to start my working stroke, which will allow me to start my activation. My activation, I'm rocking, going from here, and I'm using lateral pressure, using a pull stroke. Okay, now I'm going to go back to the line angle, and I am going to do my strokes in direction. Okay, I'm going to do vertical, I'm going to do my horizontal, and you also have your oblique strokes here. Okay, and I'm going to come all the way around and roll it into the interproximal around that mesial line angle interproximally. Okay, it's all about the rocking and the rolling. You rock on your fulcrum finger and you roll around the line angle interproximally. Okay, very good. So remember, again, you have the primary function is for your debridement or the removal around of the crown and the root surfaces, to remove calculus. Okay. Again, you can use this for anterior as well as posterior for super and subgingival calculus. Okay, this is your universal curet. Again, you have the lower shank here, which is this part here, which is closer to the working end, and then you have, also known as the terminal shank, you have the round back. Okay, you have the face of the instrument, which is 90 degrees to the lower shank. You have, again, your handle. You have two cutting edges. You have one there and you have one on this side here. Okay, it is important to know that when you adapt your instrument, okay, you want to make sure again that you use the one side. It's the very side of the working end, and it's the side of the tip. Okay, so we want to always make sure that that's what we're doing. It's very important to make sure that you have your patient in the correct position here. Okay, here we go. Okay, because you want to have your light. Your light is important. If you're working over the mandibular, you would like it directly over the patient's mouth. If you're working on the maxillary, you're going to put it over the patient's chest, and then you're going to roll it up to the maxillary. Okay. So we have again the Columbia 1314. It is limited to normal sulci and shallow pockets. All right. That's the 1314. Columbia. This is Dexter. This is me, Allie. I will be also going over other instruments with you as we continue on this tutorial / blog with hygiene hands, which are light hands, and patients love light hands. Implement enough lateral pressure to remove calculus. If you're doing a deep cleaning, my suggestion is to make sure that your patient is anesthetized. If you're just doing a prophylaxis, light hands, explain to the patient that they need to be anesthetized in that case. If you are doing scaling and root planing, or if the patient has tenacious calculus that requires a little bit more pressure, which could be some discomfort to the patient. Again, this is me coming hygiene hands, aka Allie, coming live from the clinic with my instrumentation. And we thank you, and I hope that this tutorial was very informative. Have a great day, and I will see you soon. Hygiene hands, very light hands for scaling. Thank you. Have a great day.